Today we're going to be, our lab is going to be arterial blood gas and drawing some blood gases. Here we have a blood gas kit. They come in different forms, different packs, depending on the facility and what they want to purchase. This one is complete. It has a, let me go ahead and open it up and you can see exactly what's in here. So this is what's inside of a blood gas kit once we open it. Okay, let me turn this camera around so you can see what we're doing here. Okay, so in this blood gas kit you have a biohazard bag. Okay, this you will be placing your blood gas sample in. Okay, you probably need to get some ice to ice it, and you'll place it inside the bag. We will assume that we have ice in this biohazard bag. Next, you have a few things. You have your blood gas syringe. You have a syringe shield. A needle shield that will protect the needle that's inside of this inside the cap for the needle. Okay, and move this bag out of the way. So this is the cap for the needle. There's a needle inside of there. This is the auto lock for the needle once you're done drawing your blood gas. You have your syringe here. Okay, it's marked all the way up to 3 liters. Basically, when you get this blood gas kit, you want to just make sure you push it in because it is a little sticky initially, because it's probably been in storage for a little time. So you want to push it all the way down and then pull it back to the amount of blood that you're going to pull out. And I set it to 1 milliliter. Okay. Then you have your needle here and your needle lock. That you want to make sure that that whole assembly is snug to the on the syringe. A lot of times they're pretty loose and they will come apart like this. Okay, so you want to make sure that it's that you put it in nice and snug, and you kind of push it in a little bit. Okay, so this is the one thing that you're going to need is a blood gas syringe with the needle on there. Okay, this kit here actually gives you another needle. This is actually a little bit longer. This, if you were going to be doing a femoral stick, you will need a longer one. This one is, again, this one's 22 gauge. Okay, it is a little bit bigger. Okay, than this needle over here. 22 gauge, and it's a 1.5 inches long. This one is just a 23 gauge, and it's actually 23 indicates how the larger the number, the smaller the needle opening is. Okay, so it's a 23 gauge, only 1 inch. This is an extra one in case they need to do a femoral stick, which you would need to go a little bit deeper, and the needle needs to be a little bit bigger to get a femoral stick. So we'll put that up here out of the way. We're not going to need that right now. Inside your kit you still have another thing. You have this is a air vent port. It actually, once you draw your blood gas, you're going to place this, remove the needle, put this on top of the syringe, and we will expel any air. And once the blood goes into the top of this, let's move it closer to you. When it goes to the top, the little white part inside of there, it will saturate it and it will lock the air. No air will be able to leak out of that blue vent port up there. Okay, so that way you'll have only a blood sample in your syringe. Okay, so you need that. You have a couple of pads here. This one is the iodine povidone iodine prep pad. This one you will clean the area, the skin area first prior to applying the alcohol pad. A lot of times you probably will not be seeing them doing this, but they recommend that you clean the area really good with this, and then the alcohol pad right before you introduce the needle. Okay, so we'll put that here. Next, you have your alcohol prep pad. So this you will go ahead and prepare the area after you've done the iodine prep pad. Okay, put that right here. You have a 2x2 gauze. This you will use to apply pressure. You will fold it, ideally you fold it in fours like this, and then you'll apply this pad to the as you're removing the needle from the brachial, the radial artery, or even the brachial, but and then you'll apply this pad with pressure. Okay, so I'm going to open it. I'll just keep it folded right here. Then you have your Band-Aid, which we will open up. I'll go ahead and open up right now. Want to try not to get it contaminated. Okay, that'll be your Band-Aid. Let's put that right up here. And then what's left in the bag, we're done nothing else here other than a label. So this label here, you're gonna, sometimes you can use this label to write down the patient information, time, date, oxygen that they're on, or ventilator that they're on. Sometimes you can get a pre-printed patient label that will go ahead. You can use that along with this. You can put the oxygen and date and time and all that stuff as well. Okay, so this is all that comes inside of a blood gas kit. Okay, so we will be doing a blood gas procedure here on our mannequin arm, and you can see what is needed and how we perform it. Okay? Okay, so we're going to go ahead and prepare this arm. And before we do that, we want to do the Allen's test. Okay? The Allen's test is a procedure to check for collateral circulation in the ulnar artery. Okay, the radial artery runs on the thumb side, medial to the patient, thumb side, and it's within about an inch from the crease of the elbow right here. Okay, so this is where you're going to palpate the pulse. Is going to be about. See, this is midline here. We'll pretend we have a we'll fold this. This is about a 1 inch square. Okay, so we'll put the crease right down here, and we'll put the paper label here right in the middle of the wrist. And basically, this square area is where we're going to palpate for the pulse. I'm going to zoom in just a little bit so you can see. Okay, so the pulse, let's put this label back there. The pulse is going to be right about here. This is about 1 inch right above the crease on the medial side of the inside of the arm. Okay, so this is where you palpate for a pulse. The radial artery is right there. The ulnar artery is in the opposite location, just right on this side here. So you have the radial artery, ulnar artery. We never draw blood from the ulnar artery, only the radial artery. But we need to check for collateral circulation. In other words, if we do any damage to this radial artery, we will still have blood circulating, perfusing the arm through the ulnar artery. So we want to make sure that we are performing an Allen's test. Okay, so if this patient, for instance, is not responsive, maybe they're sedated, and you need to do an Allen's test. Well, you can't do the actual Allen's test, which you would have learned already. I'm going to just zoom out a little bit. I'm going to show you what Allen's test would be like. Okay, so this, if the patient was awake and alert, for instance, here's my arm. I have my radial artery right here, my ulnar artery here. I would have the patient squeeze their hand a few times, and then with both my hands, I would squeeze both artery, ulnar and radial, and I would open up my hand. And I'm going to go ahead and take my glove off so you can actually see what it looks like, because you can't. You have to see what it looks like. So you're looking at my arm, my hand here, and you can see it's a pinkish, there's a little some white spots, probably whatever it is, circulation, who knows. But anyways, so I'm going to go ahead on normal patient. I would have them squeeze their hand like this, and then I'm going to go ahead and occlude both ulnar artery, and they can squeeze it real tight. Then they're going to open their hand up. You can see my hand is still whitish. I'm going to release the ulnar artery, my thumb here, and it should pink up, and hopefully you saw that. So it pinked up, so I know I have collateral circulation. But when it comes to patient that is not responsive or they're sedated, we need to do the modified Allen's test. Okay, so the modified Allen's test is basically you're going to go ahead and try to remove any blood that's in the hand down towards the arm. So what you're going to do is you're going to go ahead and occlude with your hand, your thumb, two thumbs, you occlude the ulnar and the radial, and I'm going to raise the arm up like that for a few seconds. And then what I'm going to do is I'm going to release the ulnar. I'll release it, and you should see the hand pink up. If it pinks up, then you know you have circulation from the ulnar artery. So if you do any damage whatsoever to this radial artery, that we know that the patient has circulation to the hand. Okay, that's pretty important. Another item I did not just talk about, supplies that are needed, are going to be goggles. You should be wearing goggles, and of course I'm wearing gloves. You should be wearing, protect yourself, but goggles as well, because when you draw blood from the radial artery, if you don't apply pressure or put the gauze at the right time, sometimes you will have blood that will spurt out, and it could come on your clothes, and it could spray you in the eye. So you should be wearing goggles, unless if you wear glasses normally, you have your glasses on. Okay, I wear glasses, so I'm not going to be using these goggles. Okay. Okay, guys, I'm going to go ahead and get a little bit closer. I'm going to zoom in a little bit. I'm going to show you the syringe here, the blood gas syringe. Okay, we have, you want to make sure that you never recap the needle with your hand. You can scoop the needle protective shield. You can put the needle in it to protect it, but you should never recap it with your hand. I'm going to go ahead and if you look in here, really hard to look, but the needle has a bevel in it. Bevel is like a kind of a cut at an angle. I'm going to open the shield here so you can look at it, but you got to be careful. See, it came out just like that. You want to make sure the needle is actually, you turn it in really tight and snug and twist it. But we also have to make sure that bevel is facing up. Let me go ahead. I'm going to face it up because I'm turning it, and I'll show you what I'm talking about. So now I'm going to remove this slowly. There we go. Okay, so here's the needle, and the bevel, as you can see, I'm going to bring it a little bit closer. You can see that it's, I don't know if you can see that. I'm trying to get good angle there. See the tip? The tip is kind of cut at an angle, and that needs to be facing up when we're going into the patient's hand here, okay? So let me angle this a little bit more down so we can see. Okay, so I'm going to go ahead and you can see how I'm going to scoop the needle into the cap, like so. Okay, so I'm not doing it with my hand, and I have it capped, and now I can actually secure the cap back on the needle. Okay, so what you're going to do is I'm not going to use this iodine prep pad, okay, because we're using the mannequin arm and it actually might stain the arm. Okay, but in real life you should be using this first before you do the alcohol pad. I'm not going to use it, okay. I'm going to use the alcohol prep pad. Okay, I'm going to go ahead and put this on. I also have a Band-Aid. Remember the Band-Aid? I'm going to go ahead and remove it. Expose this sticky part on one side here. Throw the other part, and then on my hand, I'm going to just stick it right on my hand here. Okay, so that way it's held on to my on the glove of my hand, and the pad is still covered up. Okay, so then I'm going to get my alcohol prep pad. I'm going to open this up. Okay, we get rid of that, and then I'm going to go ahead and prep the area. Okay, what you want to do is move the dirt away from this area. You don't want to like rub around in a circle, because all you're doing is rubbing that dirt around in the same spot. Okay, I'm kind of moving everything away. Okay, and then we'll dispose of that. I'm going to get my gauze that I will be using to stop the blood when I pull the needle out. Okay, I'm going to have that kind of set on the side here, somewhere where I can reach it. I'm going to put it on this side, on the other side of the arm, because I don't want to have to reach over the arm to get it. I'd rather just stay on my left, on the other side of the arm. Okay, let's move it out. So I have the gauze pad right over here. So after I stick the patient to get blood, I don't want to have to reach over and get the gauze. So I'm just going to keep it right here because I want to grab the gauze right away and be able to stick it right on that site. Okay. So the next thing I'm going to do, I've already prepped the arm. I've already done the modified Allen's test, and I do have collateral circulation. I'm going to go ahead and get my needle. I've already set the needle for the bevel to be facing up. Okay, the opening of the needle is facing up, and it's kind of chiseled off at that tip there. Okay, I'm going to remove this. Be very careful that you don't have to accidentally recap it. I'm going to pull it out just like that. Okay, and you can see that I have my locking needle lock mechanism on the side. Okay, have my bevel up on top, needle is on the side, because if this needle cap is on the bottom and my bevel is on top, I won't be able to. You can see that I'm hitting the arm here. Let's move in a little tighter. You can see I'm hitting the arm when I'm trying to do a needle stick. So you want to have it on the side. On the side, okay? So what I'm going to do, let's see if I can get this camera in a little bit tighter. Okay. So you can see my needle. What you want to do is feel for the pulse. Okay, I'm going to put my needle down so I can show you this. You want to hold the needle with your dominant hand, and you're going to be introducing the needle at a 45-degree angle. Let's zoom out a little bit so you can see this. 45-degree angle, like this. You're not going to go straight down like this. You're going to do it 45-degree angle, bevel facing up, okay? And you're going to go into the skin. You never want to remove the needle after puncturing the skin a little bit, you're just contaminated. You can't go back in. You have to get a new needle. Okay? So we're assuming this needle is still clean. And I'm going to zoom in just a little bit so you can see right there. So this is pretty much where I'm going to feel for the pulse. Let me turn this arm towards you. I'm feeling for the pulse in that 1 square inch area, okay? Right here. I'm feeling it with the tip of my finger. Okay, there's different ways of doing it. Some people like to use one finger. Some people like to put one finger up a little higher and one a little lower, and they can feel the pulse between the two and stick between your fingers. I don't like that because you could accidentally puncture your finger and now you have an incident report. Okay, so I like to use one finger and I'm feeling for the pulse. I'm moving my finger just ever so slightly to feel it on the tip of my finger. Once I feel it on my finger, I'm going to move it away. As you can see, I'm moving it away just slightly until I do not feel the pulse anymore. And then what I'm going to do is I'm going to go ahead and advance it just until I feel the pulse again at the tip of my finger. Okay, so I know that the pulse is at the tip of my finger. I'm going to get my needle. Okay, I'm going to get my needle here. You can see my bevel is facing up. I'm going to puncture the skin at an angle, 45-degree angle, and I've just moved my finger ever so slightly back because I know the artery is right at the tip of my finger, and I'm applying a little bit of pressure because once you puncture the skin, the artery is going to want to naturally roll away. So if I anchor it with my finger here, it's not going to move. So let's go ahead and puncture right there. And you can see, you see the little flash right up here? Then you know you entered the artery. Once you see that flash, do not go anywhere else. And what we're going to do is I'm going to reach over and simulate the pulsation. There. Okay, let's zoom out a little bit so you can see what's happening here. And now the needle is moving up. Okay, and it went to the 1 milliliter. As soon as I'm done, I'm going to keep that needle in there. I'm going to get my gauze. I'm going to gently place it over the needle, and I'm going to pull the needle out. At the same time, I'm applying pressure. Okay, and you can see now I'm going to go ahead and lock this needle with the cap like this. And I just locked the needle with the cap. I'm applying pressure. You're going to apply pressure up to 5 minutes or until the bleeding is stopped. Okay, so I'm holding pressure, and with this one here, I'm going to kind of roll this syringe around, circulate, move the blood around, get it to mix real well. Okay, I'm going to remove that needle syringe, the needle off of the syringe. Next thing I'm going to do, keep pressure on here. I'm going to get my Band-Aid. Okay, get that ready, and I'm going to lift up, make sure that the bleeding has stopped. If the bleeding has stopped, I'm good. I will keep that gauze on there, and I will apply the Band-Aid onto the arm here. With a little slight pressure, I'm going to put little snugs there, okay? So now I have this needle. Let's lift this up so you can see what I'm going to do with the needle. Okay, so I have this needle here. I'm going to remove it. Okay, I'm going to go ahead and remove it right here. Change hands. Okay, there is no, which is pretty nice, there is no air in here at this time. There's no air in the syringe, but if there was, let's pretend there was some air in here. There. So we got a little bit of air in here. We need to get that air out because this 21% air, it can actually change the concentration of the oxygen in there. So what I'm gonna do is I'm gonna go ahead and just do a little tap and allow some of the air out, just a tad, not too much, because you don't want to push that all the way up and it squirts straight up. You want to do ever so slowly. I'm going to put the vent cap on, like that. And then what I'm going to do is I'm going to go ahead and push up the air that's still in the syringe, slowly. Okay, you can see I'm pushing that up. And the blood's going to go up. It's going to saturate the white. There it is. It's just saturated. And now no air can come in or out. And I have removed all the air out of this syringe. Okay? So now this is good. You might want to roll it in between your fingers like this to mix the blood, because this syringe is pre-heparinized on the inside, and you want to get that heparin in there to help it not coagulate. Okay, next thing you're going to do, you're going to get your pre-labeled, your label that's already pre-printed, for instance, with all your information right on it. I'm going to put it on the syringe like this. Okay, then I'm going to get my biohazard bag that has ice in it already, or some material that's going to keep this blood nice and cool. You might end up doing blood gases. You might have 4 or 5 blood gases you have to do, and it might take about 20-30 minutes before you get to the lab. So putting it on ice will slow down the metabolism of blood and cause it to kind of, be ready once you get to the lab. Okay, so I'm going to put it in the bag, biohazard bag that has ice in it. Let me go ahead and seal it. And then off to the lab it goes. Just remember, you want to clean up your mess. You have needles, you have your paper, and all these different parts that you want to go ahead and discard. This and the Sharpie. And also you want to come back after maybe about 20 minutes or so and check on the patient. Make sure that there is no bleeding. You already checked before, there wasn't any.